Hi, I'm Dr. Tony Mork, a board-certified orthopedic surgeon, endoscopic spine specialist, and my practice dedicated exclusively to the practice of endoscopic spine surgery in the past 14 years. The question I'd like to ask today is, how often is back pain coming from something or some structure other than the back itself? Back pain is the second most common cause of disability in the United States. And low back pain, or back pain in general, is the leading cause of job-related disability. This represents a $50 billion, that's with a B, $50 billion a year problem here in the United States. The main problem centers around the fact that multiple structures can refer pain to the same area. And I will tell you what the main, at least the thoughts are behind this, but I'd like to give an example. Let's talk about groin pain for a moment. Groin pain can be referred from something retroperitoneal or abdominal, such as a hernia. It can also be referred from an arthritic hip, and it can also be referred from a bad disc in the lumbar spine. So groin pain is an area that the pain is referred to, but there's not really an easy way of figuring out where the groin pain is originating from. This is the main problem. It's one that I call a diagnostic kind of an issue or problem. The main reason that it's difficult to figure out exactly where the pain might be coming from is probably twofold. One, the area in the brain responsible for the sensation is really not that large in comparison to the size of the sensation area in the brain for the hand or the face, for example. These areas are much larger. So the actual accuracy of perception of pain is one that may not be differentiated because there's a smaller area in the brain dedicated to this. Number two, oftentimes the nerves that are responsible for back pain are the same nerves that are responsible for hip problems, back problems, sacroiliac problems. So the main contributors to back pain, of course, is the back, but the other main contributors that are non-spine in nature are the sacroiliac joint, the hip, which is the ball and socket, and then retroperitoneal structures. For example, many years ago, I had a friend who, as a youth, had tremendous back pain. And it was always, they could never exactly figure it out, but he also had Crohn's disease, which is an intestinal inflammation. When they operated on the Crohn's disease and took out a portion of his intestine out, his back pain resolved. So you get a sense of what I'm talking about for referred back pain symptoms. In 2009, in the journal Spine, there was a study of about 200 patients, and these patients were being evaluated for their low back pain complaints. Of the 200 people, there was a age group between 11 years old and 92, with the majority being between 40 and 65. There was also a requirement that they could have no previous back or hip surgery. Of the group of people, this group of 200 people being evaluated, they found that the back was really responsible as the cause in 65%, or about 2/3. Approximately 14% was coming from the sacroiliac joint. About 10% came from the hip. And by that I mean either arthritic changes or perhaps even a torn labrum, which is the kind of the soft tissue seal around the edge of the hip. And 10% could not be figured out, so unknown. They had back pain, but no cause. The upshot of the study was twofold. Number one, identification of the pain generator was difficult or sometimes not possible. Number two, there's no particular consensus about how to go about this in a logical form. So in people who have complaints of back pain, there's the spine is a possibility. There's sacroiliac contribution about 14% of the time. And then if there's a problem in the hip, this can also give rise or mimic low back pain as well. The other causes that are non-spine, non-hip, non-sacroiliac joint can be abdominal. So thanks a lot. I just wanted to touch on some of the non-spine causes of low back pain today, which you might be interested in. If you got further questions, give me a call, drtonymork.com or at the office. Thank you very much for listening today.